Medical research plays an important role in helping clinicians understand how diseases develop and interact with each other. But how does medical literature actually influence the evaluations of medical evidence within the VA disability system? So one topic I want to talk a little bit more about today briefly. So we're going to explore how healthcare professionals use research studies and scientific publications when forming these medical opinions. It's also how VA disability evaluators evaluate your conditions at the C&P exam as well. So what is medical literature? Very briefly and very basically, it refers to studies published by peer-reviewed scientific journals. It's very specific that these studies examine topics on all levels of medical conditions, not necessarily specifically for VA disability purposes. And so it could be looking at disease mechanisms, treatment outcomes, risk factors for illnesses, long-term health patterns in certain populations. And researchers will collect this data, analyze the results, and publish findings so that other clinicians and scientists can evaluate and build off of this information. Now, the medical community usually has a huge delay in when these things are adopted into actual practice of medicine, which is why it's not part of what your doctor does to treat your condition. It's a very important part of the process, but before it's published or accepted, it needs to be evaluated by other experts in the field to ensure that that study and methods, all in conclusions, are scientifically sound. So this often is something that might need to be repeated multiple times over decades before it's accepted. So evidence-based medicine, this is modern clinical practice. This is where it relies on that research and incorporates it into treating the diseases that you may have today. So there's three components of this: scientific research, clinical expertise, and individual patient circumstances. Research studies provide valuable insights into how that disease behaves across large populations and oftentimes large periods of time, could be years, decades, maybe even longer. Every patient, though, has a unique medical history, and medical clinicians need to interpret this research finding in the context of your individual patient situation. And so establishing a biological plausibility is one thing we look at. So one important role with that literature plays in helping establish that biological plausibility. So what does that mean? It really refers to whether there's a scientific understood mechanism that can explain the relationship between two conditions. So for example, research has explored how chronic stress responses influence the body's hormone systems, how it influences inflammatory pathways, and also how it can influence the cardiovascular function, so how well your heart works. Those pathways can help explain why certain conditions may appear together more frequently, so they occur more frequently with each other in some patient populations. Understanding these mechanisms can help clinicians evaluate whether a particular medical relationship is reasonably connected. Population studies. So we talked briefly about mentioning that. So population studies and risk factors for developing a condition. So medical literature can also identify patterns that occur within larger populations. For example, studies may find that for certain medical conditions, they occur more frequently in individuals with particular exposures or a certain type of health history. Those findings will help clinicians understand the potential risk factors and how they contribute to the disease development in certain populations. However, research findings that describe trends within populations rather than they're not guarantees for any individual patient. So we have to let the clinicians consider both the research and the individual patient history when forming those medical conclusions of, does this apply to you? There are some limitations in research. This is important to understand. So although research studies are incredibly valuable, they have limitations. So not every medical question has been extensively studied. Some conditions may have limited research availability. Some conditions may be complex. They may have other outside influencing relationships between multiple diseases or other risk factors that aren't fully explored. And those results could be tainted in some way because of that. So research findings may evolve over time. So as people continue to research these conditions, new information comes up, and what is previously thought of as a conclusion may change. Because of this, clinicians combine available research with their clinical experience and their patient-specific information when evaluating these medical questions. So at the end of the day, medical literature helps us provide a scientific foundation for understanding how diseases develop and interact. But it needs to be combined with the clinical evaluation and specific patient history. It can help clinicians form evidence-based conclusions about complex medical relationships. This is why it's not a one-size-fits-all situation, even when research